For those who are here in attendance and also those who are joining us on live stream, I'm your moderator for today. I'm the News Director of Communications Fiji Limited, Vijay Narayan, and we have been working through the Leadership Fiji program, the 2019 and 2020 Laudala documents that were prepared. One I do remember 2020 through a Zoom session to continue to review the Laudala document on what we should be doing in relation to this crisis that we are facing. The years that I've stated, a lot has to be done, and as the UN Agency on Drugs and Crime Regional Director Collie Brown has said, we need to take action now. There's enough of dialogue. And that's why this dialogue is very important, because out of this will be an action plan tomorrow, which the Ministry of Home Affairs will be urgently taking back to Cabinet to ensure we take those steps quickly. I'd like to thank our panelists for today. We will be talking about demand reduction, education and awareness. And we will have our first speaker now, who is a Drug Free World founder, Kalesi Volatambu. And Kalesi will be talking about the situation on the ground, how it has developed, how can CSOs and NGOs assist in combating illicit drugs for both supply and consumption. Thank you, Kalesi.
Thank you so much, Vijay. Good morning, everyone. How are we? Come on, look alive. Okay, so Drug Free World Fiji came into Fiji in 2019. We didn't know or understand what the landscape regarding drugs in the country was at that time. If you look back 5 years ago, we couldn't have this kind of setting openly. It was behind closed doors. We wouldn't talk, we wouldn't talk about drugs in the church, in the Vanua Lomanikoro at home. So it's been a huge fight, campaign all the way through. It's not just about us, Drug Free World. I'm looking across and I can see a lot of our partners sitting in the room right now. It's not just about us, it's about you guys as well. And that's what, collaboration, partnership is all about. We want to fight this, and it's not just, going, how do we move forward from just a talk fest? We need to actually see what it looks like on the ground. And I can see we have so many great programs that's been running through CSO, NGO. You guys are doing fantastic work on the ground. There's only a few things I'm going to actually talk about is raising awareness. United Nations Office for Drugs and Crime this year, we celebrated on the 26th of June to commemorate International Drug Days on the 26th of June. The theme for this year is investing in prevention. So we need to look at prevention, not just on the law enforcement side of it, but at the same time, the other social elements. What are the social issues and everything else? First and foremost, we need to look at raising awareness all across, not just in the school, but at the same time looking at the human element of it. There is somebody, there is a family attached to it, there's a community attached to it, there's a school, there's the villages, and at the same time, how do we empower those communities, those young people, those teachers, those parents? Those are some of the things, the gray areas that we need to look at, because it's not just about locking them up, mandatory sentencing, because it does not work. I'm so glad that we're going into narcotics court, because it's all about the restorative justice, the healing process. The other one is advocating for investment. We need to lobby, and I'm sure I'm looking across the room, we've got some CSO, NGO, the platform that you're sitting on. We need to look at investing in that, utilizing that to actually look at, who are partners, what can we do? What's an investment? Because it's not only about dollars. We came here, Drug Free World Fiji in 2019, and when we started, we weren't funded. We just stepped out in faith. And see, this is the outcome where we're sitting right now, where we can actually have this frank conversation with stakeholders, with government, with private, and at the same time, media. That is the other element that we really haven't maximized, because they play a huge role. The other one is empowering, like I said, empowering your communities. How do we equip? How do we train our turangani kor, turangani yawusa, songo marama, walmilotu? How do we contextualize it to Fiji? Internationally, We need to encourage that, but at the same time, we need to contextualize it here to Fiji. It's like how you're weaving a mat. When you weave a mat, everybody has a role to play. But we need to start changing our language as well. How do we introduce our own language for Fiji, not forgetting the victims, the family, those substance abusers, because they are somebody's child. The other one is facilitate collaboration. This, on itself, this is a great example of how we can enhance this. This is not the one-off. We look forward and look beside you. Start networking. Because I'm sure when we start collaborating, we share what resources we have. Can you imagine how we can maximize the resources, the limited resources that we have? The other one is provide evidence-based for policy making. That, in hindsight, you know, after talking with Minister Pierre a few days ago and the Archbishop, we need to really look at research-based. We need to encourage that. We can't say, you know what, the government's going to deal with it, they're going to fix it. No, they need the help. So we need to remove whatever our differences are, whatever barriers that we have, put it aside. If you're all for fighting for Fiji, a better Fiji, you know what, let's step up. Let's be frank. Let's just, you know, throw our head in the room. What can we do together? We need to encourage that. Engage our community. First and foremost, that drugs does not discriminate. It doesn't care what political affiliation you are, what age group you are, what gender you are, what, you know, wherever you're from. It doesn't discriminate. So we need to look at that and that approach. We need to come together and fight this together. And obviously, the last but not least, international cooperation. Let's look at what they've done. Learn from their lessons, what we can do differently for Fiji. It has to be Fiji-owned and Fiji-driven. We ask them for help. We walk with them. They don't lead us. Nah, we walk with them. Thank you.
Thank you, Kalesi. That just sets the platform now from the ground in terms of what we need to achieve during this panel discussion. And remember, this is a Talanoa session, so there will be quick presentations just on the brief issues at hand to set the scene, and then we will get into the discussion with you on finding some solutions or feedback from the ground. So Fiji-based solutions, very important issue there, and learning from what other countries have done, where they've failed, what strategies have they used, and looking at our strengths, what are some of our strengths. And with this panel, some of the panelists can provide some of those ideas that can be put together in this consultation paper that becomes the counter strategy with the urgent action. I'd like to next invite, based on the list that's confirmed, the acting CEO of the Substance Abuse Advisory Council, Joshua Naisele. Now, Mr. Naisele does a lot of good work. He deals with what's happening in the school system. And we know that they're based not too far away from here, the old Delainamasi school facility. And I was just talking to him before this on whether there's any other facility of this sort because of the growing issue in the school system. And he said, this is the only one. So there's no other facility for Substance Abuse Advisory Council within the school system apart from the one here in the Sinu. So just putting the thought in your head, when we have the discussion, we can discuss it further. Over to Mr. Naisele. Thank you.
Naka Vijay. Good morning to all of you. Before we address any problem in school for the Ministry of Education, we always try our very best to try and understand what the students are going through. Many of them, they go through a lot of situations that can affect their mental health. In our unit and also throughout Fiji, we have counselors who are providing this service to the students, not only on drugs but on other issues that affect them. So through the counseling process, we managed to collect some of the information, we can say in-depth information about what the students are actually going through. The kind of family or the parental upbringing, and all other social issues that affect them, that affect their intellectual growth, affect their social growth, that affect their emotional growth, social growth. So through that platform, we come up with some of the strategies on, the ministry come with some strategies on how we can address the drug problem. Number one is the increasing in the number of counselors. You will note that the ministry has recently opened 4 counseling hubs throughout the division, one in Suva, one in the west, one in the north, and one in the eastern based at Levuka Public School. So the provision of counseling allow the counselors to listen to the students, because that is one thing we believe, to understand what they're going through before we go for solution. We listen to them first and try to find out what are they going through before we discuss, and they have to come up with a solution on how best they can tackle the issue that they are facing. That is one, and through listening, we're able to find out that the parents, they need help. So we have a community program, community leaders training. One, we just started with Seru province last 2 months, and with the UNEDC for supporting, and also for Drug-Free Fiji, Ministry of Health, and Itoki Affairs. Probably we're going to roll this out to other provinces in Fiji, because we wanted to empower the parents and the community leaders on how well they can protect the students in that environment. Because what we also find during counseling, the students, when they go through different environment, the family environment, community environment, school environment, their peers environment, social media environment. These are all the environment that they are exposed to, and sometimes when we do not empower them well, they can easily be swayed to the kind of things that they go to, especially if it is a new thing for them. So the community leaders. Number 2, another one, when we do counseling, we also provide counseling support to the parents. So the parents have to come. We realize and acknowledge the support that the parents need to provide to their children. I'm talking about drugs. So when they are coming in for drug counseling, by allowing them, giving an opportunity to share the story and for us to listen so that we can understand before we address the problem. So some of them are doing drugs just because of their peer pressure. Some because they use it as a coping technique to mask the pain that they go through. Some of them are victims or survivors of abuses, child abuse, sexual abuse, emotional abuse, neglect, exploitation. So when we give them that platform, it allows them to share and kind of lighten their burden. So the ministry at the moment has 4 divisional councillors. In the next submission, the next financial year, we want to fill up the 9 district. There should be 9 district councils, and also to have the councils in the large secondary and primary school, because we see you'll note that the number of students that are in the school, especially in urban centers, there are many. So there's some kind of overcrowdedness in the classroom at the moment, and that put pressure on the teachers as well. So by listening. Number 2 is the collection of data. So we conduct the drug data survey every year during the Ida Diet, as mentioned by Ms. Kalezi. From that data, we find out that in the last 3 years, the drug use in schools, primary and secondary, seemed to increase. Last 2021, we have about 2,400, 2,800 in 2022, 3,500 cases in last year. So the trend is increasing, even though the numbers is less. The percentage, because the percentage is less than 2% when we compare to 200,000 students all over Fiji. The percentage is less, but the trend is increasing, and that is worrying. From that data, we are able to target the schools or the district, education district, which has high cases of drugs. And then we visit the school, do awareness, and also conduct training to the teachers and the child protection officers on how well they can support the students in school. But one of the things that we find out during counseling is this: the students, when they go and do illicit drugs, when they go and smoke marijuana or meth, when they do meth or even cocaine, they started off with illicit drugs, cigarette, tobacco product. They started off with drinking angona, alcohol, because they experience and they go through this every day. Sometimes they think they did is normal. Because all the student clients that we see who are doing drugs, none of them started off with smoking marijuana straight away. No. They started off with these legal drugs. and then they continue to increase, and then they start to try, because part of growing up is for them to experiment things. So one of the things that we would like to suggest, if in the community or in our villages, how are we going to protect our children from these legal drugs, we can say? We are targeting illicit drugs here, illicit drugs. But how about the illicit drugs, the ones that are legalized? If we can stop that and protect them from that, that can be one way in which we can help them not to do other types of drugs. And moreover, the ministry, you will be aware that whenever addressing drugs in school, we have the policies and the acts that we follow: the Education Act, the Crime Act, the Illicit Drug Control Act, Substance Abuse Advisory Act, the Child Welfare Act, and we have the school drug policy, we have the school counseling policy, and the school behavioral management policy, and the child protection. These policies are used by the teachers in school. If there are cases coming up, then they have to intervene using these policies as a guide. And in the curriculum, we have drug themes and topics covered in primary school, healthy living, and also in secondary school, the family life education. So in the review of the curriculum, current review of curriculum, the topics of drugs is going to be included and expanded so that all these illicit drugs can also be included. And apart from that, we have the training program that we conduct every year. So what we are doing now is to try and empower our students. Instead of targeting only the parents, we empower students with leadership skills, building their characters, decision-making skills, problem-solving skills, and coping skills, because the important thing is for them to know how they look after their mental health. When they go through a difficult experience, how do they cope? When they feel sad, how do they cope? When they feel worried, how do they cope? These are all the things, the negative emotion that they experience. Sometimes it can drive them to do a lot of negative things if we do not guide them properly. So leadership training, teachers, child protection officers training, and also faith-based training, and also community leaders training. And apart from that, we also have the awareness program in schools, and also community continue nearly every week. And also we're also using social media platform and the multimedia on spreading the information, and of course the International Day Against Drug Abuse, Illicit Trafficking, that is normally commemorated every year on 26th of June. This is a national program for all the schools in Fiji where they create awareness on the dangers of drugs. And we thank all our stakeholders for the support that they've been giving us, especially our partners, DFAT, in the provision of the refurbishment of our counseling hub, and also UNICEF, UNODC, UNESCO, and other NGOs that are providing counseling. These are all our stakeholders, and other ministries, of course, that provide support to us. I believe for this symposium, it is very important for us to talk and discuss what will be the positive way forward on how to address this problem, because our children are our future, and the support that will be provided by all other stakeholders will enable us to work together and to protect our children from this issue of drugs.
Thank you very much, Mr. Naisele, and that will be further discussed, no doubt, in relation to the Substance Abuse Advisory Council that is part of the education ministry system and the work that it's doing. The reported stats there for you: 3,500 cases last year, and that continues to. Those are reported cases, and they are worrying because now we're finding hard drugs like methamphetamine in schools, and the students have been taken in for questioning, and other details will be provided as well. Again, we need to urgently act on this. Our next panelist is a person who has been doing a lot of work on the ground as well, the head of the Catholic Church in Fiji, His Grace Archbishop Peter Lloyd Shaw. His Grace.
I just have two stories to tell, that's all. The first one is from my own life. You know, many of us have families that are involved, are either drug users or abusers, or as Joshua said, little drug lords selling drugs. And I have both of that in my family, and it's like a thorn in the flesh when you have family members who are either using drugs or being small drug lords selling it. And it's painful to, as a church leader, to have family members, and I know the pain and the negotiations and how hard it is to convince these are family members to drop this thing. And I remember one time we were coming back from a concert, a reggae music concert, and you know reggae music is as close connections with drugs. So one of my cousins said, "Hey, why don't you try a little bit of marijuana? I mean, so that when you preach about marijuana, you know what marijuana is." So I told him, "Hey, you know, some things you don't have to try to know it's bad. Eh? You know very well if you run full speed at this wall with your car and yourself will be damaged. You don't have to try it to know it. Some things are like that." The second story is this. It's the story of the village by the side of the river. Every morning, the village women go to the shore of the river to draw water. One morning, one woman arrives a bit early, and as she is drawing water, she notices a baby floating down the river. She yells loudly, and one young man, a very good swimmer, comes running up, dives into the river, rescues the baby. People were happy. The next day, two women go together to the shore and notice two babies floating down the river. So they yell. Two men jumped in and rescued the babies. The next day, three more babies float by. The young men rescued two of the babies, but one floats away. The next day, more babies, and this goes on. Towards the end of the week, the village community has a meeting. What can we do? They said. Babies are floating down the river. We are rescuing some, but some are drowning. So they said, let's organize ourselves better. Let's get some kind of strategy, well-planned response. And so they organize. They get some people to spend time looking more closely at the river each morning, and they organize good swimmers, train them. They organize some people to get the firewood to make a nice fire, some people to cook some hot food for the rescued babies, porridge, some people to make clothes for the babies. And so the village organizes itself strategically for their response. After another week, they say, we can improve our response. Let us build a high tower, and then we can see when the babies are coming down from far away. And let us get donor funds to start a special school for training swimmers. Everything went forward very well. A month later, the villagers had another meeting to evaluate what has happened. How is their action plan working? In the midst of a discussion, a young man rises to say, why don't we organize a committee to go up the river and find out who is throwing these babies into the river and what we can do to stop that. The villagers argued about this suggestion back and forth. And somebody said, but if we send people up the river, there will be fewer people here to respond to the immediate needs. Moreover, if we go up the river, it might be dangerous because the people who are throwing the babies into the river might throw us as well into the river. They vigorously debated the proposal and finally decided, let's build the tower a little higher, let's train more swimmers, let's collect more firewood. And so over the next several months, the villagers do indeed save more babies, but more babies are also drowning. So what's the moral of the story? What's the lesson of the story? The obvious lesson is that you can have the best efforts, strategic plans, and responses to a problem. But if you don't deal with the one throwing down the babies from up the river, the root cause, the problem continues. You can waste a lot of resources. We can have symposium after symposium like this, and we'll go through a symposium burnout. A lot of effort, a lot of energy, without taking the moment, the time, the energy, the sacrifice, the danger of doing the necessary analysis. And in some of the church groups, we call this the social analysis, and it's part of the whole cycle of how do we respond effectively, as the O'Neill or Coleman was mentioning. How do we make our target hit the target? How do we answer the question that the Minister of Home Affairs was saying, the why question? So doing a proper analysis, a social analysis, answers or targets to answer that question. First, we want to look at what is happening. We've heard that a little bit from Joshua. We need to be really affected by the problem, and so that it pains us to see the problem. Then we need to move on beyond what is happening to ask the important question on which plans are based on, and that is why. Why are the babies floating down the river? What is the root cause? And so this is probably, I want to make the point here of the importance of asking that why question and asking what is the root cause of any problem, a social problem. And particularly social problems, we need to do a social analysis of why, what is the problem. The danger, and I see this a little bit in our program today, we start from what we see and we jump into the action without analyzing the problem, skipping the analysis. That's like going to the doctor and same time the doctor gives you one injection or one Panadol without doing an analysis, taking your blood pressure, taking your other necessary test analysis before they give the prescription. So the importance of doing a proper social analysis to ask the question, what is the root cause of the problem, will help us and help government, help Fiji put together the answer to the why question, help us to provide a good response that targets the problem and makes our solution more effective. Thank you.
Thank you, His Grace. And again, this discussion, as we are saying, is the theme is all set here in terms of making sure that action comes out of these discussions. Dialogue is not enough anymore. And if you see the Lodala documents from 2019 and 2020, the analysis being done, the questions that were being asked, some of them still have not been addressed to date. And yes, we can say because of COVID-19, and that's why urgent action is needed. We now have the Fiji National Council for Persons with Disabilities, Executive Director Lemeki Rangilau. He will be also discussing the issue as part of the panel discussion, and we give the floor to Mr. Rangilau.
Thank you, Mr. Atish, and thank you, the Minister of Home Affairs, for the invitation. Well, the big question that we would like to raise here is what can we do from the disability sector, disability point of view, taking in mind the vulnerabilities, the challenges that we face, and we can be, it can be a big risk, especially for persons with disabilities. And sometimes we have to be proactive. Much has been shared this morning on what is going on. And one thing is for us at the disability sector is to raise more awareness. And information is very important. And awareness that should go right down to the communities. I think that has been said this morning, that it's not only the work of the government in trying to combat this, I can say this disease, or this challenge. And it's everybody's job. And it has to go right down to the community. So I think from us, in order to do this, we have to tailor-made the awareness or the educational training into right down to the community, so that, as you're aware, that we have challenges. Persons with disabilities have different challenges, and they can be very high risk to this. They can be vulnerable to substance abuse because of their challenges. For example, because of, as been shared, it can be a coping mechanism for them in trying to solve this like anxiety and all these things that usually come up with persons with disabilities. And they can turn to drugs to help them. But so when we have information trickling down, right down to the community, it will can help us. For us, we have persons with disabilities, and then we have the carers, and of course the family. And these are the people that should be trained or should be made educated on this. How can we assist persons with disabilities for them not to take drugs? And on the other side, we should have a proper support mechanism. Say, for example, because mostly we have the support mechanism in the urban areas, when we should also have this in the community. I'm speaking mostly because of what we are facing at the ground and at the grassroots level, the community. And we are so thankful to the CSOs, the NGOs, that the work that they are doing in the community. And I think that we should tailor-made this training, so this like for us, like the communication, the communication of this of the awareness when it comes to the visibility, when it comes to the reasonable accommodation that should be provided to persons with disabilities, so that they can understand and they can also be told. Because if information is not full information, it's just like it's not good information. Information should be, full information should be taken right down to them. If they take drugs, what can they have? as you're aware that information is power. So when they have this kind of information, they can refrain from them from taking drugs. And I'm talking about the support system. For example, because of our vulnerability, due to the poverty, due to unemployment, and those things that can make us to take drugs, so that we can help us in whatever that we want in life. So the support system, for example, like if we can have that in the community, in terms of peer group support, we usually have that in the urban areas. Some of those that have, we have an organization within the disability sector which is called the Psychiatric Survivors Association. So the psychiatric, those who have survived from from psychosocial disability, they usually come together every Thursdays, and they come and sit down and they talk about it. How can they reach out to the community? And I think these things should be going right down to the community. We should have a very clear referral pathways, especially for someone that is, what are the signs, what are the symptoms, so that people in the community can understand, oh, this person is taking drugs, or this person is because of drugs, something like that. And when we have that in the community, and then we have the support mechanism to support them, so that they can get counseling, so that they can hear stories, how people have survived from the drugs, those drugs, those using drugs. So I can just start off with that. Those are some of the things that we can need. And secondly, we should have accessibility in terms of infrastructure. When it comes to health care, when it comes to whatever the services provided by the government, we should be accessible to that. Because sometimes, because of our disability, sometimes we cannot access those services, even though they are there, because of the infrastructure, the buildings and things like that. So it should be accessible so that we can go reach out there. And because of we've been sometimes we can be, discriminated, but then we should have those kind of mechanism, should have those kind of things in place, so that we can also have the much information on the drugs abuse, what area drugs abuse. Thank you.
Thank you to the Executive Director of the Fiji National Council for Persons with Disabilities, and our panelist, Swire Shipping Fiji and Drua CEO Mark Evans is next, and on the theme that's been talked about here, using sports to counter illicit drug activities. Thank you, Mark.
Thank you, Vijay. Morning. I'm not quite sure what I'm doing here, to be honest. But I'm a terribly obedient sort of chap. So when they say, will you come along, I sort of automatically say yes. It's a weakness, I know. But I'm going to talk a little bit about how not to use sport. I've worked in sport, professional sport, for 30 years. Before that, I was a teacher in a high schools in the UK. And I'm also at the end going to say a little bit of perspective coming from not being Fijian and coming from a country and an area of the world which has had a long-standing illicit drug and problem driven by organised crime largely, and a reflection, I suppose, of some of the mistakes that countries such as my own have made. And Fiji might, in my opinion, I may be being a little naive, might be in a better position to respond. So first of all, sports. Well, first I'll say what you shouldn't do. Don't use people like the Drua and say, can we use your players to say don't take drugs? Right? Because it doesn't work. Okay, so don't bother doing it. It's nice and glamorous and it's fluffy and stuff, and the people who organise the campaigns like it because they're hanging around professional sports people, but it's a complete and utter waste of time. Okay, the individual sort of glamorous role model stuff, we've tried it, and it doesn't make any difference. And you also run the risk, of course, as when a very, very high profile player then does something they shouldn't, then that whole messaging gets completely destroyed. However, do I think sport has a role? I think in the whole process, yes I do. I think it's a limited role. It's not nearly as important as some others, but it's got a role. What is it? What's sport good at? Well, I'll tell you what sport's good at, and I'll try then to tie it into what I think the key issue is. Sport's really good at bringing people together. It's really good at creating standalone support networks of people with a common interest. I know that from my own experience of playing, it doesn't matter what sport it is, by the way, at all. You know, it really doesn't. Team sports, though, are particularly good at this. And I know from my own sort of, isn't it what do you say these days? Because I'm really right on, you know, lived experience. I never knew what that meant, to be honest. But I know from my own experience that certainly in my teenage and 20s, the people I went to first for advice and help and support were people I played sport with. Because you had that kind of bond, you had that kind of trust, you had that kind of interaction that you don't get from many other activities, I should say. That's quite good at that. It's pretty good at messaging, and this is different from getting a high-profile sports person to come and just say, don't do this, kids. It's really pretty good at getting over a messaging, because one of the things it does, it crosses lots of boundaries. And I'm going to now, so for example, people told me before I came here to do this job, and I didn't quite believe the extent of it. They said, you will not believe when you get there the level of penetration and the breadth and how the team crosses a whole load of class, gender, ethnic, geographic divides. And that is absolutely true. There aren't many things that pull whole countries and whole regions together in the modern world. We've become quite fractured, and sport is one of the few. There are a few more in Fiji. There are a few more in Fiji than I'm actually used to be honest. But sport is certainly one of them, and it's very good. It's part of strengthening civic society. It's very, very good at getting people who wouldn't normally associate with each other to do things together. And it's particularly good at things like big events. And you look, there aren't many things that bring 15,000 people together out of a population of 900,000, but you can do that in sport. You can do it at the Coca-Cola Games, for example, and you can do it at Drua against the Canes. You can do it at a number of things. But if you can get some messaging going there and all the rest of it without being too worthy, I think that's got an interesting role to play. The Minister said right at the beginning about why we need to know why our children take drugs. I don't think that's a very difficult question to answer, if I'm honest. And it isn't all about abuse and deprivation, and which is true in individual cases, but some of the highest level of drug taking in the country I come from comes amongst the richest, most privileged, most well-educated people in the country, right? So it's not a simple cause and effect thing, but I think young people will always rebel to a degree. They'll always take risks. They think they're never going to die. When I was 19, I thought I was going to live forever. Now I'm 64. I'm terribly disappointed, frankly. They'll always push boundaries. They'll always experiment. And they'll also do things that feel good. And people ignore that. Human beings have always done that when they were young. It's a question of not doing it in a very harmful way, and it's not doing it with things that are clearly very dangerous. And that's a very, very difficult balance to strike. Where I think my country and others like my country have fallen down, and where I think Fiji has an advantage, and I think I would build on this as much as anything, is social, what they call social capital. In Western Europe and North America, we have got a massive decline in social capital, where people do things in large groups together with a shared interest. And that brings a level of cohesion and a level of influence that means you can mitigate many of the worst effects, not just of drugs, but of other antisocial behaviors as well. And Fiji's got much, much more of that than any other country I've ever lived in, and I've lived in a few. And it's also got something else I just want to mention right at the end. I think it's got a scale. Fiji is a relatively small country with under 1 million people. That's an advantage in this particular situation. I'm going to say something. It's very hard to keep a secret in Fiji. Everybody knows everybody. It's great. I love it. But that's incredibly important when it comes to intelligence gathering. I know this bit isn't about the supply side, but I'll just finish with this. Yes, you have to work on the demand side, and yes, you have to work on the harm minimization side. But don't be so naive to think that young people will never experiment. They'll just experiment with whatever's available. The availability is really, really, really important. The gentleman here made the point, without using the phrase, about gateway drugs, and we've learned about that a lot many, many years ago. Very, very few children and young people go straight to illicit drugs. They start on substances that alter behaviors that are legal, and then move on. Countries and towns and villages and cities with really good social capital can make the number of young people who move on much further quite small. And others, the number becomes completely out of control. And that, as an amateur, knowing nothing about this work really, is what I think our challenge is. Thanks very much.
Thank you, Mark, and that sets the scene again in terms of what role we play. And we have been talking about it for some time. As Mark rightly points out, as soon as we know there's someone who's dealing with drugs or doing drugs, within a few weeks maybe, people know, okay, that's where that house deals drugs, that's the place it's going to. All these vehicles are stopping at this place. I think there is also an important issue to look at about people are turning the other way. And for those who are joining us on Fiji Village on the live stream as well, the fact that you are engaged in the discussion, we'd like you to ensure that you also take the action that is being requested. One of the things that I'd like to throw back to the panel now is about the issue about our social capital. Mark raised the issue. We only have less than 1 million people in this country. Where he comes from, population is around 65 million. It's harder to find out, it's harder to deal with the control, it's harder to deal with the demand reduction, the awareness. Are we doing enough, and why are we not doing enough? Why are we not touching on the issue of this great asset that we've got in social capital, in social cohesion? I'll ask His Grace to start, please.
A very new word to me, the social capital. So I'm just Googling what social capital means. It's not in my theological language. So what I'm getting together, it's investing on relationships and positive relationships. Is that, Mark?
It's more about, it's certainly in Western Europe and North and the global North, or whatever you want to call it, right? We become increasingly atomized. More and more people live in their own. More and more people, if they do have a social unit, it's a very small family unit, and therefore and social capital is about trying There's some great books written about it. It's about trying to reverse the trend that individuals interact with fewer and fewer people over time. Because then trying to have social norms and trying to have things that are accepted and unaccepted, the way we do things, becomes more and more difficult.
Yeah. Well, that falls in line with the proposal that I had presented to the Ministry of Home Affairs and Ministry of Education. Along that, and I like that word investment, but because government and society needs to invest on this social capital. Social capital, because of the changes that are going on now. With the cell phone, it says it makes us more connected, but actually it makes us individuals. So what I'm proposing, and I proposed to Mr. Tikondondua, is one section of life, and at the moment it's just dealing with teenagers, right to young adults, and because this seems to be the most vulnerable group. So if we have, and this has been my argument with the Catholic parishes that I have been doing a ritual which is called confirmation. It's actually like a young introducing initiation of young people into Catholic adult Christian life, and the youth, and developing a youth ministry at different stages in life. And if we invest on this, listening to Joshua, that a big group of the vulnerables in drugs is indigenous Itoke. Majority of the Christian population is indigenous. If we take the churches as a ground for making sure that we have a strong youth group and accompany young people in these various age groups, from early teens, mid-teens, tertiary level, and right up to adulthood. My argument has been, when I go around this weekend, I'm going to Nandi, and I'm going to speak about this. We will be investing, almost bringing up a new culture of people, and by investing on accompanying our young people, so that they are in good relationships, and then when they get married, they will pass on to this to their children, the same that they have experienced.
I'll give the floor to any other panelists who wants to get into the discussion. Joshua, that's an important one. While you're getting that mic, we were just talking during the break, and the general manager of CFL, Charles Taylor, brought up the issue about, while it's easy to say that parents should take responsibility and look after their children, and we know that there's a good discussion. Always it ends up with the family support, but there's also about, in this changing age and environment where the parent is stuck in traffic for most part of the day, and in the afternoon reaching home late because of the traffic, the corridor, the working hours, and even the issue in relation, for example, the nurses now, they're stuck on 12-hour shifts. So if you take 12 hours at the hospital, by the time you reach home, and we don't know what time the child goes to bed, or what time the child has come back from school, and how much interaction is taking place, positive interaction, etc., and what happens after that. So these are new challenges maybe which we didn't have 15, 20 years ago, and then combine that with the increased usage of drugs and the availability of drugs as coping mechanisms. Mr. Naisele, with those things happening, what type of responses are you getting from children when you're seeing the stats show 3,500 reported cases of drugs.
Naka Vijay, I will start off with the social capital that was mentioned by Mr. Ivan. I believe for me, the way I understand this phrase, this term is that each individual, we all have gifts, talents, and skills. So in a family of 4, for example, mom, dad, 2 children, each have their own talents, their skills and abilities. Talents are given to us by God. Skills, abilities are things that we learn. So when we combine all those 4 talents and skills, they can come up with a solution on how to address that problem. So when we talk about the community in a cultural context, the Vanua, what can the Matangali do? What can the Tokotoka do? What can the Yavusa do? In their own social status, the different ranks, Matani Vanua, the Mbati, the chiefs, and the Mbete, these are all traditional positions in our own cultural context. So there is a lot of social capital exists in our own traditional system. And when we come to the contemporary structure that we have, so the individual, we all have this unique potential within us. The way we see, our mindset has to be very positive when we look at how to address the problem. The advantage that we have, like Mr. Even had mentioned, is that the population is less than 1 million. So we have a great advantage on how to address the issue of addressing the issue of drugs. What we are doing for the student, when the student comes for counseling, for me, when I do counseling, I don't focus so much on the problems. I try to help him or her identify their talents, their skills and abilities, because these are the skills that will enable him or her to be resilient and able to move on with life. Like Mr. Evan has mentioned, part of growing up is to experiment, being curious. So sometimes some people, they just do drugs and then they stop once they know, no, this thing is not good for me. So the social capital is an important concept, as mentioned by Mr. Evans this morning. That is what we need to realize that we have. So the government, the NGOs, the partners, when we all combine our effort together, it can be addressed. So the issue of that was raised by Mr. Vijay about the challenges that are faced, not the problem, the challenges by parents today on the new, when we can say the new development that the country is experiencing, creating a happy and loving, respectful environment at home. I believe that is one thing that we need as parents or community members need to continue to encourage in our own homes, because when we are not there, our children are empowered to do the right thing, not the good thing, the right thing. Values, character development, these are all important things that we need to continue, as parents need to remind our children with every day. Thank you.
Kalashi, Collie raised a big issue in relation to, just looking at what the other countries have done and where they have failed. I'll get Nicholas Fuata, who is also a police psychologist, because he said sometimes we are just looking at Euro-based solutions instead of homegrown solutions. What are your thoughts on that based on your work on the ground?
Thank you so much. That's a really great question. I kind of knew that was coming, so I was like, okay, I'm going to prepare myself. Lived in Australia for over 30 years, worked in the judicial system, and what I found, and I was experiencing, I was seeing in Australia, was the white policy. It was your generic program, and it wasn't contextualized to your indigenous or population that we have, whether it be in custody or offenders through police. And I come here in Fiji and I've seen where we went wrong over the other side, where we failed in so many areas and we haven't addressed really whatever the problem may be, whether it be, against violence, against drugs or whatever it may be, family. We need to contextualize. And I love the fact that, he raised that social capital. Soloslovaki. We know what that is. We are a communal setting here in Fiji. The Western system is your nuclear, just mom and dad and the children. This Soloslovaki, this communal system, it's already embedded with us. We just need to look at it. How do we maximize, how do we maximize that? So that's what we were finding working with Indigenous population in custody in Australia, was the lack thereof of contextualizing the program that suited to them, because majority of the population in custody, or those who were offending, were Indigenous brothers and sisters in custody. And I come here in Fiji and exactly the same. I don't want us to look at a program that's in Australia, New Zealand, America, Canada, wherever it may be. The social issues on the other side is quite different to Fiji. We cannot go there and bring it here and copy and paste. It does not work. That's why it's so crucial when we look at research. It has to be research-based. We encourage international to help us, but they don't lead us. We need to say, you know what, can you help us? Help our people. We need to look at what they have, where they went wrong. We need to ask those critical questions. Where they went wrong, what we can do best for Fiji. And we need to take it back. We need to own these projects or these programs that we need to run here for Fiji. So it's so critical. Even the language that we use, we need to be really mindful, the language that you use, because it can mean different things in different areas. So going back to what Australia was doing with the wide policy program, we really didn't master community approach, and that's what we're talking about here, and I want to push that Fiji looks at that community approach. Instead of mandatory sentencing and sending these sites into custody, no. What are the alternatives? What are the gray areas? What is the why? What do we implement?
Kalisi. I think just from the Drua perspective, and I know there's a big following for the Drua, and they play the Reds this Saturday in Suva. The Drua has got right from the beginning, the name itself, the connection to the Vanua, to the people, the big value on family. You made some tough decisions in the first year or two, Mark, and as you got that team together as a family, and the connection to the Vanua, even down to when they do the Imbole, understanding where they stand and what they do. If you can talk about how you are instilling those values and combining it with the discipline that the young men need.
Oh, this is still on, right. Yes, thank you, Vijay. Yeah, it is. We spend I think this is relevant. I hope this isn't just an anecdote. We call what we're doing the project a lot, which is a bit pretentious, I know, but it's not just a rugby team. It's meant to represent the nation. It's meant to make the people proud. It's meant to be based on Fijian values, etc., etc. And certainly, we do try very hard to root it in that. And I know a lot of the Fijian staff and people at Patheli and Natha and people do see part of their role as to, and this is without being conservative or old-fashioned, handing down the traditions of what it is to be a young man in a Fijian culture is a big part of what we are trying to do. And I think it's what I was suggesting tentatively in my little thing a few minutes ago, is that it is, I feel, social capital is just a phrase that's used in the West, I suppose, but it just means the group being strong and active and giving lots of opportunity to its members and its participants and people who have a strong sense of belonging to something bigger than themselves or their immediate family. If you can achieve that, and Fiji's got piles of that, and I know people worry it's not as strong as it was, etc., and I'm no position to say whether that's true or not, or whether it's just in the old days things were better. I've no idea. I don't know. But what I do know is it is a lot easier, it's not easy, but it's easier to keep certain social ills under reasonable control and limit their penetration into the community if you act as a village or a neighborhood or a team or a workplace. Groups and group norms about behaviors are really very, very powerful things. And I wouldn't dare to say I know the answer, but I am pretty confident that it lies somewhere in that sense of belonging to a larger group than just your mum and your dad.
Thank you, Mark. And also, we can get desensitized as well, because now every day reports are coming through of drug busts, cocaine fine, methamphetamine fine, marijuana fine, and people are just looking at the headlines and just maybe reading it and then on to the next issue. But it continues to eat away into the society. The young generation is rightly pointing out. We'll get the mic to Choili Rokondaveta. I just wanted to, he's from the Ministry of Home Affairs. This is a few action items from 2019 that I'd like to just throw back to from the Lodhala document. We had to recognize the critical need in certain areas. And Action 5 was we recognize the need to create safe spaces across the community in schools, churches and other groups where addicts and their families can go for help without being judged or prosecuted, and also the importance of community working together on tackling the issue. Choili, what has been, I know there have been a lot of drawbacks, because it seems like based on what we're recording here, we may put something along the same lines, and it may be again after the dialogue. What will ensure that there is action this time?
Thank you. Back in 2019, after we developed that outcome document from the Lodhala document, the ministry with government agencies and key CSOs went to develop the narcotic strategy. And in your case, we've been working closely with Kalisi and other existing CSOs to try and create that pathway. But now, given that there is increase in illicit activities on drugs, we are grateful that that now government has, we have the political support, we have the support from the international partners, UNODC, the US, the Australia, and New Zealand. What we intend to do is that once the strategy is approved by Cabinet within the next month or in July, we will develop an action plan, which is an annual action plan within the 12 months. And then after today, we will list down the actionable items that we can achieve in setting up in the next 12 months. And ministries and with the support of our international partners will assist us in funding these, setting up these projects that will assist communities.
Looking forward to that action plan, because again, as the Minister has said and as others on this panel, we need to act, and the dialogue has been done, and now we know we are in a crisis situation and we need to act. So again, it will be good, as it was recommended during the first Leadership Fiji Lodhala document, that we need to ensure we review this every 12 months. We need to come back to the table and people connect again. Are we doing enough, rather than leaving it for for disaster to strike us, and then when we are shocked that we're acting, and that's when it results in knee-jerk reactions, which will not be good for our country. Just Kalesi, just before we finish off, I'll quickly talk about, because I was speaking to the Turangania Vusa, who's from Serua and Ranikula village, and Remesio Garau. He is part of the program, and thank you, Remesio, for discussing this with me earlier, where they are setting up a pilot program on how 25 villages in Serua are working on something which is expected to go out of there eventually into other places as an action in motion now.
Thank you. So if we go back, this was out of a conversation where we're just going to go and do a drug awareness, have a drug talk with the village. Then we talked to Turangania Remisio, and he said, you know what, can we do a province? When you look at 14 different provinces across Fiji, Serua was one of the smallest, 25 villages. So we thought that was quite, manageable. So we thought, okay, we're going to get a group of people together. So this is a collaborative approach. UNODC, Home Affairs, Ministry of Home Affairs, National Substance Abuse Advisory Council, Ministry of Health, HIV and AIDS, Fiji Police, Community Policing, and then Drug-Free World Fiji. So Itoki Affairs. So that was a collaborative approach. So it's not working in silo anymore. We thought, you know what, moving forward, how do we do this? If we're going to train the trainers, if we're going to train our Turangani Koro, Turangani Avusa, let's do a unified. What does that look like? How do we give them the tools to actually take ownership for this? They become the legs and arms for us because government can't do everything. So how can we do that? So it was a 2-day, started off with just 1 day, and we thought we'll roll it into a 2-day thing. It's a pilot program. See how effective, how much of an impact. What was the feedback? Was it positive? Was it negative? Was there a few things we need to change? There were a few things we need to change, especially Itoki Affairs. The Turangani Koro, they report every quarterly, looking at the form. How do we review those forms that they report back on? Does it capture drugs, anything about drugs or substance abuse within that form? When it's been reported, do they get a response back of where that has gone to? So it's a whole lot of things came out of this. And how do we do it differently moving forward? 25 village, it's really small. We had an audience up to 60. It was great, the dynamics within the room. We had the elderly, the Turangani Koro, the chiefs. Then we had the women, then we had the youth. Whoa. Do you know how amazing it is when you give the platform, a safe space for a young person to stand up in front of Turangani Koro, Turangani Vusa, and speak openly about what they're seeing and how they can autonomously take this on, take ownership for this and fight from their landscape. So it's, moving forward, there were so many learnings, so many great things out of it. So it's, you know what, it's not impossible moving forward. We're excited because there is different phases to it now. They're asking, how do you go and literally train the women separately? How do you go and train the youth separately instead of just going to one area? How do you go into all the different villages now? So many things has come out of it. But one of the thing is the intel, the information they give you. It's amazing because they see what's happening in their environment. They see what's happening on the foreshore, the beaches where they're maritime. They get to see whatever's washed up on their beaches. What happens to those information? Where does it go? So it's like literally, putting the processes together as you work forward.
Definitely with the Vanua in the room and those who would like to connect with Kalesi and Turangani Yavusa, Ranikula, they are available, and he had said that he can share with you how he can assist other villages in doing the same. For those who are watching as well, we will have their contacts available if you'd like to contact us through Fiji Village. Those who are watching on live stream and you'd like to use this as a pilot program for the Vanua. His Grace, just a question in relation to a lot of these communities where deals take place or where well-known drug dealers are. The comments keep coming through that the churches are located within those areas, even some highly populated areas in Suva. People are then asking, what are the churches doing about it? What type of discussions are taking place at that level, knowing that it's happening within the area of responsibility?
Thanks, Vijay, I don't have no data or information on what's happening on the ground. That's why it's this gathering data information on the various stakeholders platforms is very important. What's happening in church, churches talking about it. A brief conversation I had with some of the women from PTC. And they are saying that, not much happens in church. Our preaching tends to be not very contextual and touching the problems that people face and the question people ask. So definitely this opens up a space that we need to fill. I was just having a very interesting conversation with three ladies from the Pacific Theological College. By the way, Pacific Theological College runs a course on social analysis for the past few years, and that's a tool that helps churches and other organizations, get to ask this very important question. What is the root cause of the problem, so that we can target the real root cause? So we talked about, even at the tea break, how we can run a workshop and awareness with church leaders so that they can begin to talk about this in their churches and have the proper language. Melanie is developing a course on substance abuse and drug abuse. So definitely we need to make the connections with the people who are working in with the theological institutes, so that we can put together our resources and knowledge, so we can begin to empower, inform church leaders around drug abuse. Yeah.
Thank you, His Grace. Looking forward to that discussion amongst the churches. So we've got the Vanua discussion happening, and then the churches expected to discuss this in terms of action, and we'll get other people talking about that as well, based on the discussions that we've had. We will have a cordless mic. Those people who may have a burning issue you want to share, because this is being recorded for the finalization of the counter strategy. If you'd like to raise something with any of the panelists, just a quick introduction straight to the question, please.
Sorry, hello everyone. Mar from Lotok Hospital. I'm so thankful to be privileged to be part of this discussion today. Listening to the discussions by the specialist, it's quite good to be able to listen through the ideas that are flowing in.
Your question, please.
My question is, I'm going to try and put a question with a story just to align the question together. The question is to the team.
You're running out of time. Just have the question.
Would there be an opportunity to invest in a intermediary facility or a rehab unit? From me as a medical person, I'm trying to save the babies as they float by. I know much of the focus is on trying to know the costs. We've had an 11-year-old admitted last week. Now we don't know if we're going to discharge him home, if he's going to have that special care that he needs to get. So again, if we save babies, what's the guarantee that once they start walking and crawling, they don't jump back into the river? So the question is there an opportunity to invest in that?
Yeah, I think the answer is rehab. In the next session, we have a full session on that, on rehab, on harm reduction. So hope that you stay on for that, because we will have an interesting panel answering those specific issues. Any other question or? Yes.
I'm John Rambuku from the office of the DPP. We've heard a lot about social capital this morning, and we can admit that there's so much about social capital here in this country and of course across the Pacific. My question is specific. Because we have so much of social capital, how do we take this story to these social capital spaces so that the story is specific and has some traction every time we do this social capital thing, all these gatherings? because we're such a communal people, and of course we have sports also. That is, that like in Rua, that takes everybody to the stadium full capacity.
Thank you, Acting DPP, for that question, and thank you for joining us and got you confirmed on the panel as well, the last panel. So we're looking forward to the discussion. Panelists, any thoughts on Mr. Rambuku's question?
Definitely, you are correct. We have a lot of already social capital compared to Europe and Australia and other countries. So, one big social capital, almost we are a believing country. Almost everybody believes in some kind of belong to some kind of faith. And as I was saying, if there was research, I'm going to preempt, and if there was a research, we will not be surprised that one big target area is the Itoke ethnic group. Just from after listening to Joshua, looking at the ethnicity in prison, so, and then connecting that with Christianity, which has a dominant Itoke population. Again, my assumption might be wrong, but that's why it's good to do the research and who are the main victims of this. So, so churches, faith communities, this is a big social capital area, and if we use these existing platforms to advocate, create awareness, empower, I think we can take advantage of that big social capital that we have. Faith.
Thank you very much, His Grace. And just going back to the Lodala document, just reviewing and auditing too. Action 1 of that document in 2019 said, invest in comprehensive research to gather data to understand and identify the issues surrounding substance abuse in Fiji. We've been talking about it from 2019. We are now in 2024. So there needs to be serious action, urgent action in relation to the data. But when I accepted to moderate these sessions, I did say that when the people come, those in authority, and we're looking forward to the sessions coming up, St. Giles Hospital is coming with some data. Substance Abuse Advisory Council is coming with some data. Police, the acting Commissioner of Police will be in the final session for today. He's coming with the data compared to before. And we also have the Commander of the Republic of Fiji Military Forces also coming. The Attorney General, Shiromi Turanga. And now we've got the acting DPP, definitely he'll be sharing some data. So there will be some data that will be shared. And we're looking forward to all of that. We'll take a short break and we'll get ready for our next panel discussion. For those who are watching, we'll be back in about 5 minutes. Thank you. And we'd like to thank The next panel, just waiting for one of the panelists to join us. Thank you, and welcome back to those who are watching us online on live stream on Fiji Village. Thank you again as you partake in these discussions, the Talanoa session on responding to illicit drugs and substance use disorders in Fiji. And as we've said, that this Talanoa today will result in a counter-strategy action plan that has to start immediately with urgency based on the situation on the ground. We've talked about some statistics that have been available, of course, in the school system. The reported statistics giving us a picture of 3,500 cases in a year as far as drug cases are concerned, and that includes cases of methamphetamine, hard drugs like cocaine being found in the school system, and the issues that we need to look at, including other substance abuse like cigarettes, alcohol, grog, and marijuana. We'd like to thank our next set of panelists to discuss harm reduction and interventions. We have Dr. Rachel Devi from the Ministry of Health, and Dr. Rachel has done a lot of work in the area of also HIV/AIDS cases in the country. And as you know, there's shocking statistics that continue to be revealed in the last few years in terms of our numbers. In the Asia-Pacific region, we are one of the top countries as far as reported increased cases are concerned. And the increased usage of intravenous methods, which is using syringes and needles to inject drugs into the system. We have the country and regional director of UNAIDS, Renata Ram, who will be talking about this HIV/AIDS statistics and what we can do. And we have Three Angels Missionary College's Gabriel Simpson, who will be talking about the issues at hand and how he has some success stories as far as harm reduction is concerned. Dr. Balram Pandit from the St. Giles Hospital. Dr. Balram, thank you very much for joining us today. So we'll start off with Dr. Rachel on the issue of the status of substance use disorders in Fiji and the increasing cases of HIV/AIDS, mitigation measures, and the way forward. Thank you, Dr. Rachel.
Thank you, Vijay. It's a privilege. I mean, all protocols observed. Respected panelists and guests, invited guests, and even online viewers. It's honestly an honor to be in the panel with the team here, and the discussion in itself is grave. It's a matter of urgency in terms of response. Now, the question you asked in terms of statistics, now that goes far and wide. I mean, you know, when we talk about injectable drug use in Fiji, well, and its relations to health, when you consider that, HIV has been one of those important rising factors and issues that's contributing to it. Now, if you look at stats alone, well, Fiji alone, in 2023 alone, had 415 new cases of HIV. I must say, we cannot 100% guarantee what percentage of that was due to injectable drug use, but you can even look at it, a good number that's coming out of it. While predominantly Fiji's statistics for HIV is sexual transmission, especially this year, we are noticing an increase in injectable drug use. I'm sorry, the exact data is something that I cannot release at the moment, but having said that, we can see almost 25% cases coming out of that space, especially even within one clinic. But that's still yet to be verified further. We do go through a verification process. But having said that, you must have heard recently in days where, and this is very unique to Fiji, something called Bluetoothing and chemsex. And Bluetoothing is absolutely super dangerous. And even chemsex, but Bluetoothing being literally you transmit blood from one person to another, where individuals get high from injectable drug use, whichever it may be, and they literally transmit that same, once they're high on that, they literally withdraw blood and circulate it amongst a group of peers. And I believe Kalesi, I'm not sure if you mentioned in the last discussions, but she's shared this publicly where they've walked into streets where they've seen this come up and literally, seeing that themselves. And that's reality on the ground. And the use of needles has increased significantly from observations. But I believe Dr. Balram will also share a good number of statistics from what they see from admission cases, because from that we are 100% sure that that is drug related. But from the HIV context, we are seeing a good proportion coming up as we're progressing, especially with the recognition of drug and HIV relations. That's something that's predominantly coming, even with pregnant women, individuals who turn up and admitted in the wards. I mean, Dr. Mara just mentioned of a case, 11-year-old in Lautoka, and we're seeing that a lot more. And people, I must say, I don't know, is it the sensitization that's going on that we talk about it a lot more, but people are quite keen and openly talk about it even with healthcare workers, which is a positive thing. They do tell us, I did inject drugs and I have shared needles, etc. So that is something that's coming up a lot more open and it's a lot more prominent. So Vijay, I think I'll leave the stats as far as that.
Thank you, Dr. Rachel. And just that statistic just coming off, and of course we'll be looking at the confirmed statistics as the numbers have said, injectable drugs at one of the labs showing about 25%. And that's concerning for HIV/AIDS for this year already. And that the alarm bell should be ringing that we're seeing a high number of cases now coming through injectable drugs. You're watching on Fiji Village the Talanoa session on responding to illicit drugs and substance use disorders in Fiji. We're here at the Fiji National University Nasinu campus, and of course the first day of open Talanoa session, and all hands are on deck and should be on deck in relation to this issue, because we need to look at harm reduction. Next speaker, we have UNAIDS and Country and Regional Director of UNAIDS, Renata Ram. Thank you, Renata.
Thank you very much, Vijay, and good afternoon to everyone here in the room and those who are joining us online. So it is a great honor to be here, and I've been working with Kalisi since 2019. So Kalisi has been very instrumental in sharing the actual realities on the ground in terms of really sounding the alarm bells early. So from 2019, we have known about this domestic use of synthetic drugs. Back then, it was still concentrated in very sporadic communities, especially among sex workers and some people with highly disposable income who are using this on a recreational basis. And from then, we've been really pushing this, trying to nip injecting drug use in the bud, trying to sound that we need to do more about it, and talking about the other mode of transmission for HIV. And so it's great to see after 5 years, even though it's a long time coming, it has come, and that's a positive, great step, that we are here talking about harm reduction. And in the narcotics strategy, it is very, it's a positive and a very progressive step to have a pillar dedicated to harm reduction as well. So my intervention or my remarks for today will be talking about the intersection of drug use and HIV infections. It's a pressing issue that calls for innovative, compassionate, and comprehensive processes. Globally, the relationship between drug use and the spread of HIV is alarming, yet it's preventable. People who inject drugs are 22 times more likely to acquire HIV than the general population. This is not a statistic, but it's a number that represents millions of lives globally. Families, communities are deeply impacted by this dual threat, a drug addiction and a life-changing virus, which is HIV. Here in Fiji, the HIV epidemic is the second fastest growing in the Asia-Pacific region. And within the Pacific, we are the fastest growing epidemic. Over the last 10 years, there's been a 260% increase of HIV infections and an 810 increase of AIDS-related deaths since 2010. UNAIDS estimates for 2023, and this is based on the 2022 data that's been released by the Ministry of Health, indicates that only 51% of people estimated to be living with HIV know their HIV status, and only 28% of those estimated to be living with HIV are on antiretroviral medication. Also, the Fiji statistics indicate that in the past 3 years, there's been an increase in HIV cases amongst men and an increase in mother-to-child transmission, and cases are becoming younger as well. The reported cases by the Ministry of Health is showing a trend of almost a doubling of new HIV cases every year since 2021. And Rachel would agree with me that before, I think, 2020, previous years, we would never go over 100 new cases. But now the trend, last year's data shows there's 415 new cases, and the ministry is expecting this to double by next year. Our first and foremost intervention must be to scale up harm reduction services. His Grace had given the analogy of the babies being thrown into the river. So we need to, harm reduction is giving a floater or something to protect the babies while they're being thrown into the river. And since we may not be able to control the person throwing the babies into the river, we can try and help them not drown. So that's what harm reduction is. Harm reduction is proven to be an effective approach in preventing HIV transmission amongst people who inject drugs, yet it remains inadequately implemented in many regions. Comprehensive harm reduction services include needle and syringe programs, opioid substitution therapy, HIV testing and counseling, and antiretroviral therapy. These are not optional luxuries, but essential life-saving interventions that must be accessible to all who need them without stigma and discrimination. Implementing harm reduction strategies is crucial in meeting the global AIDS targets set out by UNAIDS, and by providing comprehensive services that reduce the risk of HIV transmission among injecting drug users. Secondly, we need to integrate these harm reduction services with broader health and social services. People who use drugs face various barriers in accessing healthcare, and often this is due to stigma or criminalization. By creating integrated health service delivery models that include mental health services, social support, and economic opportunities, we can address the holistic needs of individuals, making it easier for them to access HIV treatment and prevention services. Another vital intervention is advocating for the implementing supportive legal and policy frameworks. Many current policies actually drive HIV epidemics by pushing people who use drugs away from the support they need. Decriminalizing drug use and possession for personal use is a crucial step towards reducing the harm caused by punitive drugs policies. And it is recommended by UNAIDS as a key measure to reducing transmission rates. Education, this plays a crucial role. We must enhance education on drug use and HIV, not only for the public to reduce stigma, but also for policymakers and service providers to provide understanding and empathy. This can pave the way for more effective and humane policies that support health and, most importantly, human rights. And lastly, something that's very critical and a lot of people in the room represent, the community. We need community-led responses, and this cannot be overstated. Communities affected by drug use and HIV are not just recipients of our policies, but they are essential partners in designing and implementing solutions. Supporting these communities to lead and inform programs ensures interventions are relevant and effective and helps build trust and resilience amongst those most affected. So just to conclude my remarks for today, we must ensure that whatever approach that we are proposing is grounded in human rights, and we must protect the dignity and health of every individual, recognizing that comprehensive services, supportive policies, and community services and community leadership are not just effective, but imperative in fighting this dual epidemic that we have, which is drug use and HIV. Thank you.
Thank you, Renata. That was the Country and Regional Director for UNAIDS. And we've got a few changes on the panel. We do not have the Permanent Secretary for Women, Children and Social Protection, and also the General Secretary for Pacific Conference of Churches, Reverend Simeone Tungi, who was here earlier, but as you know, His Grace had attended the first session, so we will be looking at further discussions. As far as government response is concerned, we have the Attorney General in the next session, so there will be some targeted discussions around those issues. The next person that will be speaking will be Mr. Gabriel Simpson. As I said, he has some success stories as far as harm reduction is concerned, based on the discussions held with the organizers, and he's from the Three Angels Missionary College. Thank you, Mr. Simpson.
Yo Mbula. The Three Angels Health Retreat down in Nadilau, Rekreki is run by a faith-based group, Seventh-day Adventists. We have been operating from 2006, and it was originally set up as like a lifestyle improvement thing, people who wanting to lose weight and all that. But then we started to treat lifestyle diseases, more and more diabetes, cancer, heart problems, that kind of stuff. And our principles are based on the Bible. We use natural remedies, including herbs, steam bath, massage, exercise, and especially healthy nutrition. And to encourage the people to make the change, to overcome the NCDs, we use the Bible. And I think it is very relevant with what we're facing today, because a lot of people get NCDs because of addictions. Either they're addicted to chocolate or sugar junkies or junk food, and you end up with one or another of the NCDs. And so the main challenge that we have is to get them to get the reliance of those things which are causing the disease. And now I want to talk, on the heart of the addiction problem. You find it in 1 Peter in chapter 2 in verse 11 in the Bible. Okay. Abstain from fleshly lusts which war against the soul. This craving, this desire to fill up the spiritual void comes from the flesh itself. This is part of the corruption, the fallout of sin that we have inherited down from Adam and Eve. Okay? And as a result, we have lost our judgmental, our decision making is flawed. You find this in Proverbs chapter 14, verse 12. There is a way which seemeth right unto a man, but the ends thereof lead to destruction. And that's the driving force behind. Like, we can know that something is wrong, but we have no power to stop. The spirit can be willing, but the flesh is weak. The root cause behind NCDs is also driving this drug addiction problem. When you conquer that, that's the heart of the problem. When you get the mind right, then the results on the ground will also come right. And I say this not because I read it in a book or heard it from somewhere else. I got it from personal experience. I have a good friend of mine, he's staying up in Idaho now. He was so addicted to cocaine for years. He bankrupted his stepfather's business. He ended up $800 US dollars a day fueling his cocaine habit, until he started reading from the Word of God. And that changed his heart from inside. He dropped the thing. He ended up staying with me in Sub-Sabu for more than a year. Come and rehab and get back again. And I say this, I know it might sound radical, extreme, but I tell you, the Word of God is the only power that can fix up this thing. And it has a proven track record. This is the same Word which motivated our ancestors to drop the war clubs, to stop cannibalism. It's still relevant today. This is the elephant in the room that we have still failed to see up to this point in time. Thank you, Vijay.
Thank you, Mr. Simpson. And our next person on the panel is Dr. Balram Pandit. Dr. Balram is from St. Giles Hospital, and as we had said that there will be some individuals who will be making presentations, will share with you what's happening on the ground and the statistics and how we can find solutions together. Thank you, Dr. Balram.
Thank you. Thank you for your kind words. And thank you for the opportunity given as well. I understand we have discussed this issue before as well, and we are discussing it again. It has already been highlighted in the previous panel discussion as well. And we are actually eager to see the actions, things moving forward. And this is also a kind of indicator that we are moving forward in form of, if you look at the sequence of paperwork which is required towards achieving some of the solutions, the paperworks are moving. I'm happy with that. However, I will come to some of the points that is expected from me, and I am also interested in sharing those things. So let's just start with some of the figures. Obviously I won't be delving deep into all of those figures, but broadly I can let you understand that last year, if you look at the previous years, last year we had more than 8,000 visits at St. Giles, which is far more than what we had in previous years. It was 6,000 something, right? And if you go before then, if you compare the data for last 10 years, then you will find that it's near double. The amount of visitations which is happening to St. Giles has near doubled. So having said that, let's come to the core issue today, that's the substance abuse. So last year when I was making one presentation and the data I have got here, The figures used to be around, specifically related to substance abuse, 20 to 30 patients per month, where you will diagnose with pure substance abuse or substance related problem. When you count the comorbid substance abuse as comorbidity with other existing psychiatric diagnosis, for example, say depression, schizophrenia or other diagnosis, so then the figures would go around 30 to 40 patients. And these are the average figures that I'm talking about, 30 to 40 patients, per month. Now, when we look at the data that we have got for this year, in January we had 103 patients. I'm talking about inpatients. I'm not talking about people who come to OPD, get prescription and then they return. I'm talking about the people who become severely ill and as a result of which they need admission, so they get admitted. So I'm talking about these figures. So in January we had 103. Surprisingly, in Feb it came to 53, right? So, and if you look at March and April, the figure is from 50 to 100 basically, right? And if you look at the type of substance which are more common, last year, as per last year's data, it was relatively alcohol which was coming at the top, but this year it's cannabis followed by meth, then alcohol, right? So that's how the pattern is changing, and it has changed relatively fastly, I would say, because in December we had looked at the whole year's data, and the figures that I just said few minutes was from December previous year, and this year it has changed in this way. We'll see what happens to these figures by end of the year. So that's about figure. I'm wondering whether you will come for second round when it comes to the solution, or you want me to discuss solution right now?
You can give your thoughts on that.
Okay, sure, thank you. So, I'm happy that one of our colleague, a doctor, asked a question in previous session, right? So, and as being medical professional, he would understand easily compared to anybody else. When I say anybody else, meaning people who do not have access to, say, medical knowledge or the informations, at least in comparison to those people, that especially when some problem increases in this way, and in general, you first focus on health promotion and prevention. Preventions are, after all, the best strategies, right? If you really want to have good control over things. So, and of course, when it comes to health promotion, you have to start your taking steps way before the arrival of the drugs, or say the risks basically, right? So, but having said that, it doesn't mean that promotive activities should not be carried out, or awareness activities related to promotion should not be carried out, because there are still people who might not be exposed to this, right? In the community, if you go to various parts of the country, you will find, right? When it comes to prevention, preventive strategies are for those who knows about drugs, its availability, and they are already at risk as well. So when it comes to risk, there are various factors. Risk is not only about availability of the drug, right? There are certain things in people's life which make them vulnerable as well. I'm happy that in previous session, people, I think one of the panelists mentioned about social capital. So strengthening social capital is really important. When it comes to strengthening social capital, it of course it can start with family, right? And one of the things that I have been talking about is like how to strengthen values in the family. 3G family, I have mentioned some of the other sessions as well. So when I say 3G family, I generally mean about 3-generation family, where you have the elderly, because I work in the area of geriatric psychiatry as well. So I look at problem in an integrative way, right? So you have someone in the family who has a lot of experience, right? So grandparents, parents, and the young children. Right? So, if the three generations are living in a family, and of course there can be pros and cons, that is understandable. I understand that some questions might be coming to your mind. So I'm saying wherever it is possible, we should try to secure that three generation family, because it's a beautiful combination. If you look at the grandparents, when they have time, they are retired, they stay at home. They can educate and take care of the children when the children are at home and parents are not at home. It can be just few hours, because of course children are at school as well, right? And then I think as parents you will be more comfortable in having your children in your parents' hand compared to having your children in a nanny's hand or someone with whom the child might not be that much attached. Having said that, it is also important to realize here that it also secures that bond, secures that attachment with family. Right? So that's one thing that I generally talk about. So 3G homes and few things which have been happening, like MH gap training of non-mental health professionals. When I say MH gap training of non-mental health professional, I'm especially concerned about not about the staff who have been trained in the capital or city area. I'm aware that some non-medical professionals have been trained from remote rural areas as well. So basically it also strengthens our capital there, say social capital there in the community basically. And then of course it comes to other things like the churches, the way churches will come together, the way for the same cause, the community will come together and various resources in the community. That's what I meant. Right? So, and then I think we also need to ensure, I'm talking about the promotive and preventive strategies. So we know that these days our children they stick to or keeps going to internet or online resources quite often, right? So how can we make the awareness activities more contextual, more relevant to them, so that they get attracted to the relevant material there. So and I think currently there are relatively less relevant material when it comes to contextual, like Fijian context, and we have discussed this thing previously in some other forums as well. Now and it's good that as I said that this is also a kind of a step forward towards addressing this issue. That's why you see people from multiple ministries involved there. So, and especially when, as I mentioned in the beginning, we need to look at the availability. It wasn't available like this before, right? So, and if you leave it, if somebody is having in that mind that health professionals are there, they can take care of the problems. Certainly not, because your resources in the health sector are limited compared to the volume of cases, the number of cases that will be shooting, and the cases are shooting already. You remember the pandemic, right? In mental health, the kind of problems and the range of problems, and if you look at the figures, people are already talking about mental health problem as silent pandemic. It's just that it doesn't kill those many people in the kind of time in which COVID killed people. So everyone panicked and tried to take action, whatever they could have taken in their respective countries. So we can't be basically leaving we can't afford to leave all these things on health sector. That's why we are all together. You see representatives of multiple ministry coming together, and I'm thankful to Ministry of Home Affairs that they have involved us, not today only, but I think we have been part of the previous sessions as well, and the work has, you can call that it's moving a bit slowly, but it has moved forward, right? So, and today again, it's kind of whole of government approach, and people from different departments of ministry is coming together. Right. So I was talking also about the strengthening family values. One thing that I must highlight is, the quarrelsome environment at home, separation, divorce, and death of parent in early age can make the attachment of children unsecured, right? Which can make them develop, as a result of which they can become, they can develop avoidant behavior, right? They can develop anxious traits, or towards they can develop disorganized traits, which can further result into additional personality disorders and mental health problems. That will certainly, that void that creates, that gets created by behavior of the adult, that is primarily not behavior of the children. So managing adult is equally important, especially in today's world, where you will see in the family it's not the kids who keep on going to online thing, is the parents as well. And unfortunately many times you will find that they live in the same home, but they do not have time for each other. All of them are busy, So the reason why I highlighted this is it's equally important to manage adult behavior. It's equally important to protect family. We are not unaware of breaking family in our society. It's not just values. You see the result, the next thing, the breaking families as well. And when the family is broken, obviously, as I said, the attachment, the secured attachment base gets broken, and they become more vulnerable.
Thank you very much, Dr.
So there are so many other things.
We will also make sure that we will have that discussion during the Q&A as well, and Charlie and his team will get all the details based on your proposed preventative measures. We have discussed, Mark Evans, the CEO of NRUA, had raised the issue about social capital, a lot of discussion, and Dr. Balram has mentioned that as well. We discussed about the younger generation and what needs to be done. The 2019 Lauvala document and again 2020 Lauvala document stressed a lot about having more counselors in schools. We were in dire need of counselors, and also questions were being raised in relation to the awareness campaigns. We stopped hearing about the HIV/AIDS awareness campaigns. Maybe it was because of budgetary issues for the past few years, and reach and frequency did not come through there in making sure education takes place. The other issue is about discipline, children's discipline, and what more can be done. How can it be looked at as far as the curriculum is concerned? So Camille Evans is from UNESCO's the organization UNESCO, and is doing some work on the ground, and she's a mental health and psychosocial support education consultant. Camille told me that she's already working with the Substance Abuse Advisory Council in looking at the curriculum development and bringing in these issues that we are talking about, so that it can be included from early childhood to secondary school education. So I'll give Camille some time to talk about that project that she's undertaking at the moment.
Thank you so much for that, and also thank you for inviting me to be a part of this panel. Many of you I've had contact with before and have been in consultation with. To tell you a little bit about the UNESCO project, I should call it a pilot project. It's actually around developing a tool that looks at integrating mental health and psychosocial support in schools. So as mentioned, it would cover from early childhood, primary, and secondary school. The idea is that when we first started engaging with the Ministry of Education, a lot of the focus and discussion was around school counselors. And in fact, when we investigated further, the school counselors were actually teachers that were trained, I think undertook a course, and were also asked to fulfill a school counselor role. And part of what we discussed with the Ministry of Education is that in order to have an effective program for mental health and psychosocial support, it had to be comprehensive, looking at not only response, but looking at prevention and promotion as well. And so, whereas having school counselors that are trained and supported and allocated the time and resources to focus on working with children that are most at risk is important. It is also important to look for entry points for prevention and promotion. And where that's most apparent in a school setting is in the curriculum itself. The tool that's been developed, it's called the RAMAS tool. It's a rapid assessment in mental health and psychosocial support in education systems. There has been a consultative process where we involved colleagues like Dr. Balam and some of his colleagues from the Ministry of Health. As I said, we worked very closely with Mr. Naselli, the SAC team, and others within the Ministry of Education. We worked also with the Ministry of Women, Children, and Social Protection. And what we identified is that there are a number of entry points if we look across sectors to be able to integrate mental health and psychosocial support. There's the family life education curriculum, which is part of the national curriculum, that already looks at issues related to healthy relationships, life skills, and although it's not directly related to harm reduction or substance abuse, a lot of the risk factors that I think we've been talking about, there's an intersection around what creates some of the vulnerability for those that may be more at risk of using substances or even becoming involved with illicit drugs in terms of selling drugs or involved in that culture around illicit drugs. And so one way to be able to interact is to be able to reinforce values, but also skills, whether it be communication skills, coping skills, and also to destigmatize talking about issues and seeking help around vulnerabilities, including using drugs. And so that can happen in aspects of the curriculum like the family life education curriculum. There's also other aspects. And one of the things that came out of the discussion that we had last week among the different ministries and stakeholders, including faith-based organizations, is that there could be a mapping of these different entry points in the curriculum. The curriculum assessment unit was very much involved. There was discussion about expanding that unit and looking at ways that we can look at these issues straight on and be able to contextualize it to the Fiji context and make sure it's addressing their needs. So this is one way that the tool has been able to facilitate conversations among different stakeholders and then come up with entry points. The other thing I wanted to mention in regards to the UNESCO intervention and the tool, specifically around harm reduction, there's a lot around stigma that came up during our discussions around mental health and psychosocial support, but obviously that's also related to substance misuse. And the idea that substance misuse is criminalized, and the fact that there is a lot of stigma for those that have the experience of using substances means that it makes it harder for them to get support. And so another way to also look at prevention and promotion and being able to integrate this within schools is promotion around being able to seek help. And it doesn't necessarily, again, have to be around substance misuse. It's being able to seek any kind of help when you're feeling vulnerable. And so this was another point that was brought up, and I think is very relevant to what's being discussed here.
Thank you, Camille, and that is great news. And I was talking to Choeli from Ministry of Home Affairs that, as the Minister said, the government cannot do everything on its own. And in this case, so UNESCO is already working with the Ministry of Education in terms of curriculum. We know that even after COVID-19, the statistics are showing a lot of our young people are dealing with a lot of mental health issues, and that's connected to what Dr. Balram is saying. More people are coming into the hospital. Now, we know that the health ministry is struggling. We know that the nurses right now have been told, even though they want to go back to 8-hour shifts, they've been told we can't. You have to, at some hospitals you have to be at 12-hour shifts, because if not, we will not be able to provide services. That's the reality of the situation on the ground. We know that St. Giles Hospital has only got a limited amount of space, and it also the only psychiatric hospital in the country. You gave us figures, 103 this year per month for January, 53 for February. What component of that 103 was substance abuse as far as drug? 103 compared to 20 to 30 previous years. So average of 20 to 30 people coming to St. Giles over previous years was substance abuse related, or injectable drugs, cannabis, marijuana. Previous years also alcohol was the main one, as Dr. Balram said. Now the leader of the pack has been methamphetamine and marijuana, then alcohol. We can see the numbers are shocking, and that's the people who are going to the St. Giles Hospital of 103 and in January, and 53 in February. It'll be interesting when he goes through the full year this year. How are you coping?
Before I answer your question, if I can, because data is about interpretation as well, like how you interpret it, how you convey the data. So these are important to emphasize that these are inpatients, right? So if you look at outpatient, the data will be higher, right? In addition to that, you also need to consider that this is a tertiary care mental health facility, which has got also unfortunately lot of stigma attached to it as well, as a result of which many people do not want to come, right? And of course for milder problem they won't come to St. Giles, right? So they will only come to St. Giles when, you know, either they become severely affected by the drug, or the family members, their behavior gets so much disorganized that family members think that it's high time it should be taken to that place. So these figures are tip of the iceberg. If you look at the school data, and if I can, if I'm remembering correctly, it's from 2021. I have the stats here, maybe instead of saying, let me say it correctly. Yeah. So in 2021, because that will give you some idea about community, what's happening actually in community, right? Yeah, so in 2021, total number of substance abuse cases, and this is data from National Substance Abuse and Advisory Council, right? So it was 2,932, right? When you compare it with 2017, it was 1,416, and but of course, since it is community, so if you look at the pattern of substance, the type of substance which are used there. So it's tobacco, followed by Suki, and then comes inhalant and other drugs, right? So if you look at the community, this is a school, which is supposed, these figures come from school reported by school teachers. And you can imagine the worst outside school, because school is a relatively controlled environment. So if you are getting these kind of data from school, of course, type of substance are different. So yep. In community,
so the reported cases, as you said, I'll come back to, because it's an interesting one. I asked you the question, how are you coping?
Yeah, so coming back to that question, thank you. So yeah, now I can maybe I can talk about the points that I was just talking about the promotion and prevention aspect. After that comes the management or the treatment part, right? So there are a few things that we have already done, and right. So we have something what we call short-term strategies in terms of coping, and then long-term strategies. Right. I won't be going too much in detail as I was going last time, but of course we are working on strengthening infrastructure. Recently, a special clinic has been created. We are about to inaugurate that, but that space is fully ready, where once a week, instead of general clinic for them, there will be a specialized care for them as well. Right. So that is, and there are other clinics that will be happening in that space. Right. And then strengthening human resources as well. For doing that, we are trying to recruit as many people as possible. When I say as many people as possible, we are aware, I think the country is aware about the migration which is happening, right, and how we are losing our skilled people, right. So in the mid of that, you are trying to manage, and it's a good question for us, that in the sense that it has also given me an opportunity to talk about the number of staff, the strength of staff that we have. So at St. Giles, in terms of nursing staff, ideally we should be having 200 nursing staff, but the current number of staff that we have is less than 85. So obviously that, and a psychiatric hospital generally they have more risky environment compared to other hospitals, right? So you can imagine what can happen, when the number of staff, the strength of staff goes down, what are the possible repercussions, right? So that also make that environment relatively, unsafe when the number of staff goes down. So it gave us an opportunity to express our pain as well, your question, right? So, but in terms of doing, recently what has happened while working at FNU, I had opportunity to develop that masters in medicine in psychiatry. So that program has started now. So slowly the human resource will be generated. So we will have locally generated psychiatrists, right? And if you look at the number of staff currently, especially medical officers, we have relatively, compared to previous years, we have relatively more number of doctors, and we are trying to recruit some more. It's good to see that currently, we have more number of doctors who are interested in working at St. Giles compared to previous years, and we are waiting for the certain requirements that need to be met, after which they will be, so in time to come there will be more and more doctors which will be coming. But we are acutely concerned about the nursing staff, right? We are also working towards strengthening, securing some relevant drugs like naltrexone and acamprosate. But it takes time when you want to put it on EML, essential medicines list. But in time to come, you will see those things as well. We are working towards establishing a rehabilitation center, and the paperwork is moving forward. We are also working towards establishing telemedicine center, which will help us in helping our colleagues working remotely. Right? And a dedicated budget has been dedicated towards it. We have already renovated a place there, and our staff have been trained in India, and intermittently the webinars keeps on going so that they can keep their skills intact, right? And then there are long-term strategies in form of mind farm. So basically this rehabilitation facility is a part of mind farm. Mind farm is a broader concept. I don't think you have that much time for me to discuss the mind farm, right? And we also aim at strengthening St. Giles Hospital facility further to transform into a kind of regional institute of mental health care and research, right? So obviously these things will take years.
Thank
so
you.
That's why I mentioned it at the end.
Thank you, Dr. Balaram. And of course, as I said, Ministry of Home Affairs will incorporate this in the action plan. And thank you for coming with your short-term and long-term strategies. The numbers, as I state, 8,000 outpatients and coming in last year. and the substance abuse related cases when it's 103 inpatients in January this year. And then just Dr. Balram highlighting that St. Giles Hospital should have a full complement of nurses should be 200 and they only have 85. So with all of that, I think open up the discussion. We have in our action plan from 2019, we need more rehab centers. How can we have more rehab centers when we do not, our current facilities cannot be fully complemented with the staff? Dr. Rachel.
Thanks, Vijay. I mean, that's actually a very important question in terms of rehabilitation and building up, especially with the harm reduction context. So I just wanted to share briefly one of the things that ministry is really working on. And while with the Ministry of Home Affairs, we've contributed to this strategic plan, and especially the harm reduction and the rehabilitation context, one of the things we've done is we've also developed we currently, as we speak, we're doing a consultation on HIV and illicit drugs as well, and prioritizing on how we will address this. Because we've talked about it, and we do know that there'll come a time when our clinicians will be busy seeing patients, and we will not be able to do outreach programs per se. So how do we do that? So one of the important strategies we've really brought to the table is collaboration. And for example, even FNU is a collaborator for us in this context. Organizations such as the Reproductive Foundation for Health Organizations, REF, MSP, Diabetic Fiji, so many organizations that are out there, the key population organizations like Rainbow Pride, etc. These teams, these individuals, these organizations are important pillars towards our preventative and harm reduction strategies. And similarly, how do we resource these facilities? One of the things that's happening is, I think apart from this, government is doing retention strategies. You must have heard on the nursing pay rise scales and demarcating with the years of service, etc. But one of the things we also do note that on an year basis, we do have a good number of nurses graduating from universities. And that will definitely contribute to numbers in the field. But having said that, there will still be a challenge on upskilling these individuals to what we need to bring them up to par with. For example, when it comes to harm reduction, we doctors weren't taught harm reduction. We weren't even taught to recognize individuals who use drugs, or even how to recognize and respond to it. So these are important strategies that literally the ministry is working on right now. And because when you look at rehabilitation and when individuals turn up to St. Charles, that's one of the last extreme of it. The in-between is what's so essential, and such as needle exchange programs that needs to happen, and the education, the recognition, and the response. So I think I'll leave it at that. But some important collaborations that's happening through a build-up of a national strategic plan within the ministry, and it's a surge response, because we really want an escalated response, because like you said, we need to do it today. We should have done it yesterday. We need to do it now. And thus the surge strategy, and this is a commitment that is actually made by government to progress with.
I just want to, we had an interesting discussion on Media Freedom Day organized by the Fijian Media Association, and we had Attorney General Shiromi Turaga, who had said that we are in a crisis. The country is in a crisis when it comes to drugs. And we highlighted as editors that, including myself, when we were talking about those things or raising questions maybe about 15, 16, 17 years ago, most of the issues were not getting confirmed. And, now we are seeing the true picture, because we have different agencies are willing to share as well. That's why I think the statistics, for some people it's shocking now, because the statistics were not forthcoming before. And I just want to put that on the table as well, because the question was asked about research and data. We have been asking. And there is another thing that we need to accept as a country. If something is going wrong, we have to share the information and look for solutions, rather than putting it away and hopefully that things will get better on its own. Why I raised this issue, the other issue we continue to, we were asking about was the urgent need for more budget allocation for prevention of HIV/AIDS. And that was another one that was left on the wayside, maybe because of budget constraints, but we see the drastic increase in the reported number of cases now. What is being done and what has to be done in relation to that? Renata, if you can start. There was some comments publicly that UNAIDS seems to have scaled down its operations here. Meanwhile, we are like a ticking time bomb.
Okay, thank you for that. Let me just talk about HIV on a global level before I can come down to HIV at the country level. So globally, HIV cases are reversing. They're not as, because of all the innovations or the programs or the prevention that has happened, funding for HIV globally is reducing. And in our world, from UNAIDS, we have not scaled down our approach. I'm here. I'm still representing UNAIDS. And however, we are using a new mechanism of responding to the HIV epidemic here in Fiji. And it's not, we're talking about collaboration, we're talking about whole of government approach. We also need to strengthen the whole of UN approach. So right now, UNAIDS is embedded within the UN Resident Coordinator's Office. So this is the highest level of UN representation in the country. So through the support of the Resident Coordinator, we are pushing for HIV to not only be UNAIDS' agenda, but the agenda of other UN agencies. So I'll just correct that, we're not scaling down.
Yes, because we're looking forward to that, because the issue is the awareness campaigns were almost nil.
Okay.
I talk on behalf of the public here,
Yes.
and we need to see real action. Now, if you are changing a strategy, when will we see increased campaigns publicly?
Okay, this is very new. It started in Feb. So the increase is coming. And also, I just want to emphasize why there was a lull, or why there was HIV wasn't well spoken of in the last 10 years. If we look at our government priorities, our health priorities, in the last 10 years, we had a pandemic, we have an NCD crisis, we had multiple natural disasters. You know, there's so many new things that came up, and of course, an issue that was a low epidemic would not get that much attention and with our resource constrictions, right? And this is the reality. But however, it's a lesson. It's a lesson for going forward. We should not take our eye off the ball. And I'm using Ratu Epeli, our Goodwill Ambassador's words. We should never take our eyes off the ball. We should always keep pushing for these messages and these agendas. And also globally as well. When we talk about, and I think everyone's familiar, about 10, 15 years ago, the height of the HIV response in the Pacific. And this was driven by the MDG goals, where HIV was specifically put out as a goal for countries to respond to. Come 2016, that changed. And it became integrated in 17 goals, not a goal on its own. So these are all global things. However, Fiji now, we will be pushing more and doing more. And not just from UNAIDS, from a whole of UN approach.
Looking forward to that.
Yes,
and the action
you.
plans, we will
we're working
continue
very
to follow that up.
closely with Dr. Rachel as well, as she spoke about the HIV surge strategy.
So, Dr. Rachel, I'll get you in that conversation as well, because we're looking at 415 new cases. 415 new cases, reported HIV cases last year, compared to maybe as Renata said, maybe 100 cases, new cases a year prior to that. So we already seeing increasing number of cases, and as she's saying that we have Bluetoothing where injectable drugs are being shared from one person to the next, sharing of needles, the chemsex, and other issues that are happening on the ground. 25% of cases in the lab for this year alone seem to be from injectable drugs. What are we doing to stop this from increasing further? These are just reported cases. Definitely more needs to be done.
Thanks, Vijay. I mean, honestly, when we talk about data, that is still the tip of the iceberg. Why we say that is we are not testing as many people as we want to. That's why we need individuals to come forth. And honestly, this is, it's not just a ministerial or intergovernment or NGO and government, it's a whole of society response, I'd say. If I could say this, if we could all in Fiji, this less than 1 million individuals in this country, test our status today, know our status today, we'd nip it in the bud right now. And from there is retention in care, respond to basically being on treatment. If you're negative, retain that status of being negative. And obviously the issues that also align with this is now we're looking at is the injectable drug use. Stop using needles, stop sharing needles with others, stop doing these unnecessary things which contribute to the HIV numbers. Now, what exactly we're doing? We are doing this surge strategy like I talked about. Now, this surge strategy is, like I mentioned, it's literally a need for an escalated response. We're increasing our campaigns towards prevention arm. That's absolutely essential in collaboration with our various key partners in the NGO, such as our key affected populations, such as men who have sex with men, sex workers, injectable drug users, etc., and even young people. Because you have to be mindful. One of the things that's happened is, if you look at the age category, our age category is actually skewed down towards the younger population. Our adolescent health are being affected. And when we look at the under 15 cases that we had last year alone, out of the 11, 8 were from mother to child, and the rest were from sexual contacts. And these are individuals who came up for example, an STI test, but we also offer a HIV test, so we tested them positive. Individuals, young chaps, young kids, less than 15, turn up to our clinics because they've unwell, but they've come in, if they've gotten their HIV status tested, they test positive to 11, 12-year-olds, and they also are injecting drugs on the streets. So these are important in prevention strategies that we really need to work towards as a collaborative approach. Honestly, Ministry of Health will not be able to do it alone. Apart from this, we need to retain our people in care. Our deaths are too many. We've come 40 years later and we still have stigma and discrimination in Fiji. Why is that so? Why can't we accept people as you are? We're a religious nation. We believe in our faiths, our various faiths that we believe in. Why are we discriminating our own people, our own children? Why are we doing this? Why are we turning our eyes, ourselves away from them? Why are kids homeless today? Where is the love and the care that we need to provide for them? I mean, those things are so essential, I'd say. I mean, apart from this, honestly, we need people in care. It hurts me to see one individual die of HIV today. Because look at the flip side, I've seen people, I mean, Vijay, I want to say this. One of my patients from 1989, still alive today, has children, gotten their children married, and has grandchildren, and they're doing so well. And there's so many individuals like that in Fiji that are doing so well, our positive people. They are just like you and I. They are just like you and I. So why do we have to discriminate against them or stigmatize them to the world? Because that is affecting our retention into care, and we really want to open that platform that people walk in, I want medications, here it is, because treatment is also a means of prevention. you're on treatment, you get virally suppressed, you literally, as for example, if you're a person who's married, your partner's negative, you can literally have a negative partner and children who are negative in life, literally for HIV. So this is all possible. So these are certain things that we're really working towards. And apart from that, we're really wanting to make sure that this is all of national response in a whole of society. Absolutely essential.
A national approach needed there. And Dr. Mara, he had raised an issue. I hope you've got your answer, but if you want to ask a question, free to do so. If the mic can be taken, Dr. Mara.
Massive work with a big patients, with a lot of number of patients that are coming through. I'm just wondering if there's another independent center that can assist the team before they actually end up with a mental health team.
Answer in short is no. We do not have a separate place, right? Which is, you can hear me well? Yeah. Okay. So, you mean a space outside St. Giles where we can take care of them adequately?
Would it assist the team?
Certainly. That's why we are aiming for that.
Just
Sorry, if I could just add on. I mean, like the faith-based organizations, like they're in...
We were approached a few years ago to establish a rehab center. We had a place marked out in Taviuni on the Vuna side. We organized our contacts in the US. They had experience in counseling in drug rehab centers. And however, so that's where it's reached so far. It all came to a stop with the COVID thing. So one thing when you start a rehab center, number one, you have to combine it with a detox. All the residues from marijuana, never mind you stop, it's still in the system. That's got to be cleaned up first. And in the long run, the candidates, the people, they have to have a sense of purpose. A lot of time they bored, they idle, they got no motive, no purpose of living, and you have to fill that void to have success in the long run. Eh? But I agree, you can't join it with a normal NCD detox or treatment center. It's got to be separate, somewhere far from town where you're not tempted to get on the drugs again. Yeah, that's some of the stuff I'm going to share.
Just on that, you got a location in Vuna, and so there were some plans already. What has happened with that? Maybe Choeli Rokundaveta for Ministry of Home Affairs? What's happening with the planned rehab center in Vuna? You have funding issues?
Thank you, Vijay. We have funding issues as well, constraints, and been discussing with Dr. Balram and the team in the previous Talanoa session, because we have 3 angels. They already institution existing. So what we discussed with Dr. Tunrabu the last time is for St. Giles to establish a framework or an agreement with this existing institution for the short term. St. Giles will act as a referral center, and then we will need to stock take first on what's already available, and then we can go from there. But as for the rehab center, there's something that we are currently discussing again.
Okay, it's in the discussion stage. We just got to make sure that we've been talking about it since 2019, according to this document. And I'm taking the cue from the presenters earlier that we got to make sure we make it happen through action.
Can I also add something? So there was a meeting in April of the Addiction Support Network. There were over 80 professionals, persons with lived experience, faith-based organizations, basically a network of potential service providers working around addiction, substance misuse issues. And one of the activities we did in that meeting was a small mapping exercise across Fiji. So not just in Suva, but looking at more remote places as well. So I think perhaps the findings from that mapping exercise can be shared in terms of the referral pathways and referral network. And also just in terms of recommendations was the idea that, yes, it's good, obviously, to have rehab centers and to have facilities for detox, but perhaps also looking at community-based interventions, particularly with faith-based organizations, or more hubs, smaller hubs, to do these types of rehab and perhaps...
Thank you very much, Camille. And as suggested by Mr. Simpson, he needs the support, and it needs to be in an isolated spot so that people do not go back when you're dealing with addicts, etc. We also, I think, based on our discussion, as I finish off here, it's clear from the Ministry of Health and UNAIDS that there's a strategy in place where they are looking at a major awareness campaign and drive in terms of hitting this information hard out there, because it hasn't been done. It's been agreed more needs to be done. And we need to put that as an action plan to make sure that we are going solution-based here. Dr. Balram has given some very good points. I think he wants to add something there.
Thank you for this opportunity again. So I think some of us have already discussed in that line. I would just like to elaborate it so that we can have more clarity. So the approach that we are adopting is kind of integrative, integrated approach. So, and you would, those who work in this field, it's easier for them to recognize that it's not just detoxification phase, right? That's acute phase of management, right? So after that, you have to have, short-term and long-term strategies again, because de-addiction requires long-term care. Because it's not just the substance abuse from which you have to take the patient away, but also you have to inculcate right behavior so that they can get attracted more towards positive things in life. They can choose those positive things better than the drugs, right?
So we have specialized care.
So basically, see, if you look at it, so detoxification can be done in places like St. Giles as well. It's actually the main result comes from the long-term care, because you do detoxification, you treat for a short while, you let the patient go in the community, they relapse back and they resort back to the same thing, right? So rehabilitation centers' main role comes for the long-term care. And with 100-bed capacity, St. Giles Hospital, we frequently get a bed blocked, right? And we are placed in a situation where we have to negotiate, discuss with the family members for relatively settled patient if they can take the patient home, and if they can give medicine to them there at home, right? I mean, of course, you have to select the patients who are, in the rightful stage to be sent back to home. But had there been opportunity, had there been more beds or more facilities there, we would have preferred to keep those patients for a relatively longer period, right? So what happens because of this short number of bed shortage is you are, in a situation where you can't provide long-term care. That long-term care, is missing at St. Giles currently. I have, no problem in accepting that, right? And the result comes from that. If you can give me just 30 seconds, right? So when I mentioned about the integrated approach, we have other things, and you will realize that we were missing these things for a long time. We have been aiming for years for halfway home, right? And we also need rehabilitation center, not from recovering from substance abuse only, but also for chronic mental illnesses. So another place for that, and then you will need a workshop for in building skills, training them. So there are other center for worried well category as well, which so there are multiple blocks in the mind farm that I mentioned a few minutes ago, and it's community based thing.
Yep.
All right.
Thank you, Dr. Balram. And as we finish off this session, scaling up harm reduction methods, no doubt very important. We have seen, as far as HIV/AIDS is concerned, the reported numbers just incomparable to the other years. It's going up drastically, and that's the reported cases of 415 new cases last year. And then the numbers that we have talked about, injectable use, those tests in the labs so far this year, about 25% of those equating to HIV positive. We also have issues in relation to the drug rehab and other areas of concern. Definitely a clear timeline needs to be put in place for those kind of things. Some suggestions made by Camille and Gabriel here, which should be combined, and to ensure that with the suggestions made by Dr. Balram on long-term strategies to be put in place, because we don't want to come back here 12 months from now and we're talking about the same thing. I have the documents here. As I said, we're talking about the same things from 2019, 2020. And yes, we can say we were struck by COVID, but we cannot keep using that as an excuse anymore. If not, we'll be having more people dying and more people going into health facilities which cannot cope anymore, as highlighted by Dr. Balram and Dr. Rachel. So thank you very much, Camille, Gabriel, Dr. Rachel, Renata, and Dr. Balram. And we'd like to thank those who are watching through the live stream on Fiji Village. We'll be back with you at about 2:30 this afternoon for a final session, an interesting session with an interesting group of panelists. We have the acting police commissioner coming for that. We have the commander of the Republic of Fiji Military Forces, the permanent secretary for E2K Affairs, Honorable Attorney General Siromi Turanga. We have UN Office of Drugs and Crime Regional Representative Mr. Collie Brown, and the acting DPP Mr. John Rambuku. So we hope to see you back here at 2:30, and thank you to our panelists who have taken out their time to be involved in the discussions today. We'll be back at 2:30. Thank you very much.